So this is a difficult question because the symptoms of chronic UTIs what really allows us to form the diagnosis. So what patients feel is a combination of the normal urinary tract infection symptoms, so pain passing urine, or maybe more subtle than that, the feeling of need to go to the toilet a lot, or maybe pain in their tummy or pain in their vagina. But fundamentally, we can't prove at all it's a chronic UTI. We take it on the basis that it's persistent and lasts a long time. The theory, the hypothesis, is that after a series of infections, urinary infections, or after a very significant infection, the lining of the bladder gets damaged and then the infection gets into the wall of the bladder itself. But unfortunately, we cannot culture bladder tissue or the wall of the bladder, so we cannot prove this. But the hypothesis is that as a result of repetitive infections, the infection gets into the wall itself and lies dormant or grumbles in the background. And then under certain circumstances and with certain triggers, it may be set off, and these are described as flares. And this may manifest as feeling like a patient has an active urine infection, but the urine sample may or may not demonstrate this. But in terms of the causation, this is the hypothesis which is reflected in the symptoms that a patient describes. So the signs from a doctor point of view in terms of what we may find is the urine may show white cells on urine dipstick when we put a little stick into the urine and test it, or we may see blood that's not visible to the naked eye, but is seen on this dipstick. Patients on examination may have tenderness in their bladder, which is felt during a vaginal examination. But patients themselves may feel like they have classical symptoms of a urine infection, such as burning passing urine, pain in their bladder, the feeling of needing to go to the toilet a lot more than normal, or they may have vaginal pain, or they may have pain in their flank. The symptoms that many women understand and recognize as being a urinary tract infection. However, when it's chronic, it may be the case that those symptoms calm down if patients treat them, but in the background they have a low level feeling of something going on inside their bladder, discomfort or grumbling or tingling in their bladder, that they feel like the urinary tract infection has not completely resolved. And they may describe this sort of discomfort or tingling or even a burning feeling in their bladder that doesn't go away, and then under certain circumstances it's triggered, such as after consumption of alcohol or caffeine or under stress, and then the symptoms become more pronounced and feel like a proper ongoing infection. So these are the symptoms and signs that you might see with a chronic UTI. So I've alluded to the answer to this in my previous answer, but essentially an acute UTI or a normal urine infection is something that is unfortunately more common in women than men for a number of reasons. Their water pipe being shorter in women, for example, and the proximity of the opening of the water pipe to the vagina and the back passage in women, which is not so close in men. But what symptoms that many women may have experienced, that after a trigger of some kind, such as having intercourse with their partner, or after drinking a significant amount of alcohol, or being under stress, or caffeine, or sometimes out of the blue, they may feel they've developed a pain passing urine, pain in their lower tummy, or pain in their vagina, or the feeling of needing to go to the toilet more frequently. And this is a typical UTI type feeling, and then patients will get antibiotics to treat this, then the feeling will then disappear. So in this situation, the acute UTI has been treated and then it resolves completely, and then patients will feel that their bladder has gone back to normal. However, with a chronic UTI, you may get that acute feeling, but then after this, you may discover that you still have some symptoms that haven't completely resolved. It feels many women are quite in tune with this, and they feel that something is still lingering there, something is still grumbling along in the background. And then this may continue for a number of weeks, and then they may get a return of the UTI type symptoms, like a flare up of those symptoms. But a chronic UTI feeling is a feeling that the symptoms have not gone back to normal, that the original episode of acute UTI is better, but just in the background there's some discomfort in their water pipe, discomfort in their bladder, that doesn't feel normal to them. In general, chronic UTIs, as far as we understand, if those symptoms are due to a chronic UTI, it doesn't appear that those symptoms and that condition is associated with any long-term complications. It doesn't increase the risk of more serious conditions. However, repetitive urinary tract infections or persistent urinary tract infections can lead to long-term damage to the kidneys if untreated. So we recommend getting treatment for this, and in particular if a patient was to have repetitive acute urinary infections, those would need to be treated. And indeed, one of the investigations for people who get acute urinary infections is to do an ultrasound scan of the kidneys just to make sure there's no scarring or trauma caused to the kidneys as a result of those repeated infections. But this is quite an unusual outcome because most women are treated subsequently, and so this is unlikely to happen. In the vast majority of patients who have chronic UTI-like symptoms, like low-level symptoms, you do not get a long-term effect or predisposition to long-term diseases associated with the bladder. So I think this is obviously the most important question, and the first recommendation with any medical condition is to try and prevent them. And there are certain recommendations that most women follow regarding their hygiene. The way they wipe from front to back is something that we tell women from a very young age as girls, and also passing urine before and after having intercourse with their partner, and generally keeping good health, good emotional and physical well-being to maintain good immunity or help prevent urinary infections. However, if somebody is susceptible to urine infections or gets a number of urinary infections, it's important to treat them when they receive them, in my opinion. So not to sort of sit it out with a hot water bottle, drinking lots of water for days or even weeks of suffering with symptoms. Urine infections are usually bacterial infections and therefore will respond to antibiotic treatment. So the first thing to do is to treat urine infections in an expeditious fashion and not to wait for them to become more significant. However, if symptoms persist and you believe you have a chronic UTI picture, or you feel like the urinary tract infection hasn't gone away, and despite having repetitive short courses of antibiotics, I think it's important to seek specialist advice and see a specialist in this area, such as myself or somebody else, who can then start a process of investigation and then subsequent treatment for it. And this may require more prolonged antibiotic use, a number of focused strategies around antibiotic use, including treatment, but then also around prevention. So once the background symptoms have been resolved, then there needs to be a process of active prevention to stop your symptoms coming back. And this can be as low level as lifestyle modifications, over-the-counter treatments that have been shown to create an environment where a urine infection is less likely to happen, such as cranberry supplements and D-mannose, potassium and sodium citrate, for example. But there are a number of others, all the way up to prescribed medications such as low-dose antibiotics, Hiprex, and in more interventional treatments that can be employed, such as treatment directly into the bladder, which is in the form of what we call bladder installations, which is the most sort of interventional form of treatment. But the first overall strategy is to eliminate, in my opinion, is to eliminate the symptoms completely, and then you transition into a process of preventing the symptoms returning. Because what makes chronic UTIs chronic is that they persist and therefore need to be stopped from being a long-term problem. So there's no point in eradicating the initial insult if the long-term symptoms persist.